Je pense que vraiment,
I think that
je vous remercie
I would
beaucoup pour
like
cette
to
opportunité de
thank you for
me...
this opportunity to take part in this debate. We have lots of discussions, quite rich ones. And the main point I want to focus on is the importance that you give to science, social science and anthropology in the management of public health. Listening to you, I'm going to be the devil's advocate. What can we do differently comparing to what our expectations? Sometimes we tend to think of things we have not done. I work in operations in daily things, but what could we have done differently in the same conditions, in the uncertainties we had in the COVID pandemic? And in the conditions we were in, I listen a lot to the presentations of sociologists and socioanthropologists, and they ask a question, we should do this or that. But in reality, in the action, in the response, what can we really do? What can we change? And this is a question that seems to be very important, and we should to draw the attention on it. We should try to answer this question. The second point that I want to mention, linked with the time dimension. Sometimes the time it takes to change behavior, to understand behavior. What is the time we need to take in phenomena where people die every hour? What can we do to act on these factors? Our previous colleague has raised important difficulties, how we do that in different pandemics. We accelerate intervention, but when Ebola arrived in 2014, people didn't know how to respond. We were lost with COVID-19 pandemic. We were completely lost. It's with this degree of uncertainty, we need to take this into account. And if we want to be realistic for next time, we need to accept to deal with this uncertainty. And one of my last points that could design future solution, we need to build some bridges. I was listening to you, the home-based care and all these elements, and I see that all these effects all have implications, and we try to follow these implications, but I really believe in this. And we need to maintain this dialogue. This community that is there is probably a community of socioanthropologists, of physicians, of public health agents. If we could talk together to find solutions when things happen, because that's there that we need responses, is not a posteriori solutions. Sometimes we then have trouble to implement them. This is a very complex problem. People start knowing each other, to listen to each other, the medical approach, the social approach, and people understand each other much better. But we need to work on this. We need all to accept to get out of our comfort zones, of our little offices. We need to discuss together the difficulties and to address them, because solutions these need to come from us all as stakeholders. I'm going to stop here, and I thank you again for inviting me.